Recognizes the gentleman from California, Dr. Ruiz.
Thank you, Mr. Chair. Administrator Regan, thank you for joining us today and for your dedication to improving air quality, expanding clean water access, and promoting environmental conservation. These are three initiatives that greatly impact the people I represent. And I'm going to speak about them and ask you questions about them. First, in terms of air pollution, my district consistently gets F grades by the South Coast Air Quality Management District for their air quality. And we have the highest rates of asthma in the entire state of California. And in March 2024, the EPA announced a rule to strengthen air quality standards, lowering the particulate matter threshold from 12 to 9 micrograms per cubic meter. This adjustment will significantly reduce the harmful impacts of fine particulates in the air. Unfortunately, my Republican colleagues seek to impede the progress and undermine the agency's ability to protect the public's health. Can you speak to the projected public health benefits of the stronger standard and how it can help our communities, specifically our most vulnerable members?
Absolutely, and thank you for your leadership on this issue and for your advocacy for proper monitoring and programs for your district. The new standard will absolutely save lives and avoid illnesses, preventing up to 4,500 premature deaths and 290,000 lost workdays. We know that that number disproportionately impacts some segments of the population. And so we have designed a public health standard that we believe is most protective of those who are most vulnerable. But it also yields $46 billion in net health benefits by the year 2032. And the thing that's really impressive is for every dollar spent from this action, there could be as much as $77 in human health benefits through the duration of this rule. So it is focused on public health for everyone, but especially those who have been disproportionately impacted.
Thank you. Secondly, over the past decade, my district has consistently been categorized by the EPA as a non-attainment due to unhealthy air quality exceeding the 2012 standard of 12 micrograms per cubic meters. Could you highlight the tools that the EPA is using to help underserved rural and minority communities like mine reduce their pollution levels and come into attainment?
Well, absolutely. Number one is we are trying to up our game in the monitoring of these areas to be sure that we have our finger on the pulse, which I believe we do. And secondly, there are a lot of technical assistance grants and opportunities that we're deploying at the local level so that we can see local innovation and creativity match with state and federal obligations. When you look at what can be done at a local level in a unique way, but also if you add some of the federal regulations that we are doing to rein in tailpipe emissions, to look at fugitive emissions and others, we believe that cumulatively that will help those communities.
Okay. And thirdly, the residents in my district have struggled with getting access to clean water. For years, I've collaborated closely with the EPA to improve the water supply at the Oasis Mobile Home Park, where residents face toxic high arsenic levels in their water supply. And since at least 2019, the Oasis Mobile Home Park has faced recurring water issues. The EPA has issued emergency orders that year due to arsenic levels in the water system being up to 9 times the maximum containment level, with 2 more orders following since then. Could you highlight the steps the EPA is taking to address arsenic in underserved communities like Oasis?
Well, absolutely, and no community should have to face what Oasis is facing. And so we've been taking action. As you know, EPA and DOJ filed a complaint against these operators. We're hoping for an anticipated trial date as early as, I believe, next year. But we have assumed direct oversight of 20 water systems since 2020. And as of January 6th, have returned to compliance because of EPA's action. We're going to continue to focus on those 14 that are left. But rest assured, the Department of Justice and EPA plan to hold Oasis accountable for this travesty and ensure that we try to make that community as whole as possible.
I hope so. A 17-year-old young man died of renal cancer, which is a possibility of arsenic consumption, chronic high loads of arsenic consumption. He had no other risk factors from Oasis Mobile Home Park. Lastly, the Colorado River Basin, which supplies water to over 40 million people in major U.S. cities, is experiencing its driest period in over 1,000 years. Thanks to the Inflation Reduction Act and bipartisan infrastructure law, the administration was able to allocate $15.4 billion for Western water resources to bolster drought resilience. Could you highlight how EPA funds such as these will properly allocate and distribute to advance the conservation efforts in the region?
Well, absolutely. First, we're working closely with the White House, Reclamation, and other agencies to be sure that we're leveraging every single dollar. We have highlighted drought resilience eligibilities and priorities in the implementation of the bipartisan infrastructure law. And in particular, our Drinking Water State Revolving Loan Fund has delivered more than $2.5 billion to the basin states for drought resilience and other critical water infrastructure. So we've not only prioritized it in terms of EPA's goals, but also ensuring that from an interagency standpoint, we're doing the same thing.
Thank you. Yield back.
The gentleman